Good morning, everyone. Welcome to Childx. I'm Lloyd, Dean of the Stanford School of Medicine. It's a great pleasure to welcome all of you in the room today and those of you who are watching through the web stream. We're in for a very exciting day and a half, and I want to begin today's session by thanking the many people who have made today happen. First, a big shout out and a round of applause and thanks to Dr. Dennis Wall, whose passion and vision has led to Childx being a reality. Let's have a round of applause. And then to Robin Daines and the magnificent staff of the Dean's Office in Stanford Medicine, who have worked to make all the logistics work and make this great event possible. I'm really excited about what we're starting in Childx. I'm very, very excited about the future of pediatrics, the future of child health. You know, in so many ways, our lives are set in our childhood. The more we learn about genetics, epigenetics, about social and behavioral factors of health, the more we discover that it all begins in childhood. In fact, the more we learn about genetics, the more we learn that it actually begins at conception. And I'm really pleased that we here at Stanford Medicine and Lucile Packard Children's Hospital and Stanford Children's Health, both integral parts of Stanford Medicine, are leaders in that continuum, of child health. And you're going to learn more about the exciting advances here and the exciting things going on in the scientific community today related to child health and development during the conference. Our vision at Stanford Medicine is to lead the biomedical revolution in precision health. Precision health is the next generation of precision medicine. Absolutely, we excel here and we want to continue to excel in the diagnosis and treatment of acute diseases by bringing the very best science to the benefit of every patient. And we want to take it to the next level. We want to also develop the science and the fields of predictive, preventative, and preemptive medicine and health, so that we can intervene before a disease develops or at such an early stage that the disease doesn't lead to its full manifestations. And what better place to do that than right here at Stanford? We have the benefit in Stanford Medicine of being an academic medical center that is so well rooted in and encompasses and works with and within this great research university, Stanford University. Just across the street, we have a magnificent School of Engineering with extensive collaborations going on between our faculty, between members of our hospital leadership and the Faculty of Engineering, and so many other schools and departments in the university. Precision health is our opportunity to lead the biomedical revolution and to create opportunities for better health and well-being for people in our communities, people in our nation, and ultimately people in the world. We're excited you're here today. We look forward to this next day and a half. For those of you who are new to Stanford, please don't hesitate to contact us, ask us if we can help you in any way. It's now my great pleasure to introduce Chris Dawes, who's the president and CEO of Lucile Packard Children's Hospital. Chris's vision and passion have brought Lucile Packard Children's Hospital and now Stanford Children's Health from a very good regional pediatrics hospital and program to now an internationally renowned leader in child health, development, medicine, surgery, all the other components of outstanding children's health and hospital programs. It's a great privilege and pleasure for me to work with Chris on a daily basis. And together, Chris Amir Rubin, President and CEO of Stanford Healthcare, and I are shaping the future of Stanford Medicine in collaboration with all of you. Thank you very much for being here. And Chris.
Thank you, Ryan. Thank you, Dean Miner. I really appreciate the wonderful introduction, and it's great to see all of you here today. You know, one of the things that we talk about, well, actually, first of all, I also want to thank Dennis Wall and the entire team for putting this together. This is really a magnificent conference, and we're delighted to have the opportunity to partner not only with the School of Medicine, but the entire university and with our partners in Silicon Valley to bring this to you today. One of the, I think, most exciting areas that certainly excites me anyway is that, and this goes back many years, when we started to really think about Lucile Packard Children's Hospital and the impact it could have on child health, what we recognized was, I think, two very fundamental principles, and that was that of preeminence and sustainability. And what we meant by preeminence was that we're part of the Stanford community. We received enormous support from this community to propel the organization, not only the hospital itself, but all of pediatrics and obstetrics into national preeminence. That we really had a great opportunity to actually achieve this objective. I mean, most organizations always say, well, we shoot for the best, we want to be the best, we want to be preeminent. But I think we're one of the few organizations that actually has an opportunity to really achieve that. And that's because we're part of this incredible Stanford community here on campus and throughout the Valley. The other was around sustainability, and sustainability in part has to do with economics, but the other part of sustainability is really how do we drive to the future. It's not about tomorrow, it's not about next year or even 20 years from now. It's how are we going to have an impact on the long term? How are we going to really impact child health throughout the country, throughout the world, and how can we do that? And what this conference is all about, in my view, is the work that is being done and the work that needs to be done in order to have a really profound impact on child health, not only locally, but nationally and internationally. And that's why it's really an honor to be part of this organization and to be here today as part of this conference where there's going to be an opportunity to talk about the innovations that are going to move us forward. And with that, the last comment I'd like to make is that not only do we have this chance for innovation and moving forward, but the other great opportunity we have is also coming together. Because one of the great advantages, I think, of conferences such as this is it brings people together around a common series of objectives and goals. And that's what I think that we can actually achieve as well today. So I do again want to thank Dennis and his entire crew. I want to thank the Child Health Research Institute led by Dr. Hugh Obradovich for providing a lot of the funding for today. And again, I want to thank Dean Miner and his entire team for helping facilitate this organization, this conference. So again, thank you all very much. I appreciate you very much being here.